Can we get onto some specifics as far as is possible in a short show like this about what your approach is to the problem then, Alan?
Number one, it's really to look at the patient. I think in the past, sort of vestibular rehab has got a bit of a sort of a poor judgment, because people just used to give lists of exercises. You know, like anytime if you give a recipe, a list of exercises to somebody, it's better than nothing, but it's really not very effective. And the most important thing is to actually base your intervention on the person right in front of you, which is obviously what you guys as osteopaths do most of the time anyway. And so I tend to look at my assessment, and I'm looking for dysfunctions, so things that the patient can't do, or things that are not working well. So, for example, eye movements or whatever, and or looking for things which provoke symptoms. And so then you pick one or two key movements or symptom provocations, or one or two key dysfunctions, like, for example, the ability to follow a moving target with your head, for argument's sake, and just give the patient these 2 or 3, 4 key things to work on. And like anything in the body, if you work on something, it gets easier. You practice it, it becomes more straightforward. And so they then get easier and will become asymptomatic within a week or two. And then you progress to another thing. You find something else that the patient can't do, or something more challenging, or you make the exercise harder, or you just keep on pushing on, homing in on the problem as best you can.
And are these techniques you've developed yourself, or are they the basis of in-depth randomized controlled studies?
No, it's vestibular rehab has been around for a long time. These are sort of quite well-established ideas, and probably all I do that maybe some people don't is just sort of pull different strands together from different areas, rather than just religiously following the vestibular pathway or the musculo-skeletal pathway or the neurological pathway. I tend to pick things, from each, because we're all trying to really restore normal movement. However we do that doesn't matter. But in restoring normal movement, we're restoring normal proprioceptive feedback to the brain, so everything is going to be a lot easier for the brain to work out.